Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Melek Somai. He's vice president and chief technology and chief product officer at Inception Health and the Froedtert and Medical College of Wisconsin Health Network. Welcome, Melek.
Well, thanks for having me, John.
Yeah, excited for this discussion. You know, we're here at AWS reInvent talking about cloud and AI and all these amazing solutions. But before we go there, tell us a little bit about yourself and Inception Health and Froedtert and MCW.
Yeah, thanks. I'm Melek Somai. I'm a physician and also a statistician. I'm the assistant professor of medicine at the Medical College of Wisconsin. But more importantly, and this is why I'm here at AWS, is I'm the chief technology officer and the chief product officer of Inception Health, which is the innovation and the digital health arm of Froedtert Health and Froedtert healthcare system today. We are an academic medical center in southeastern Wisconsin, and our mission is to deliver the best care experience and the best care to our community and patients.
That's awesome. You know, I think most health systems have moved away from developing their own solutions. I mean, they used to develop EHRs, all sorts of things. What led to your decision to create a digital health solution for your patients built on AWS?
Yeah, I mean, you're making a really interesting point, which is technology started if you think the first mover in technology was actually healthcare. I mean, the first known AI developed at MIT was ELISA, and it was actually developed by a psychiatrist. It was actually for mental health.
Wow.
And if you think about the first paper about computing, it was by Warner Slack in 1950s. Actually in the New England Journal of Medicine, and it was about computing and medical record. So if you think about the journey of medicine and healthcare specifically, it's been driven by technology for a long time. I know that we moved away, and most of it is moved away probably from operational effectiveness. The idea was initially that technology is probably a back office. It is not core to the clinical service we deliver, and that's why let's outsource it to other vendors. And what we're realizing actually after that experience is actually there is a point where caring for patients also means that we need to build the right digital technology solutions, and we need to be builders again. Because the same way we take care of our patients in our clinic at our offices should be the same care we should by providing digital technology. And we kind of coming back to this full circle where our investment as a healthcare system is our mission, which is taking care of our patients. And taking care of our patients today in our day and age, and with the challenge we face as healthcare, means also that we need to be building the right technology and making access and convenience key. As you are aware, one of the biggest challenges in healthcare, we cannot scale. And how can we deliver the right care experience to patients today and for the future? Unfortunately, we cannot build more medical schools. We cannot train more clinicians like that.
We probably should, but you're right. The problem, we can't scale humans to the problem. We need technology.
And absolutely. And if we want to actually stop the curve of cost and curve it and challenge it, we need to start thinking about innovative way. Our current model is not scaling. And that's kind of our approach of why we believe that investing in digital and building digital not as actually the end goal, actually making digital as part of what I call our clinical technology stack. What are the capabilities that we need to have as a healthcare system to deliver the care experience? And one of it is becoming an engineering-driven and product-driven organization.
Interesting. So tell me a little bit, how does the solution work? What technology services are you using to make it happen?
So we started being cloud native. So the first component of it is we started with this greenfield approach. Most healthcare systems built today on-prem. But by building the technology, we decided that there are going to be three focus areas. We're going to focus on people. So we need to actually create a new type of engineering-driven teams. So we focused on building an engineering-driven organization. We build an organization, what we call a product-oriented team, and it includes user researcher, user designer, engineers, and clinicians. That's a new model that exists everywhere outside healthcare, but not in healthcare. So we brought that experience from AWS, from startups, from others who have been successful in really shaping an industry, and we learned from those. I think if you look at AWS Re today, it's a massive, massive event. And the type of innovation that happens is amazing around this. And that's kind of what we need to be part of. So we build this around people first. The second was technology. And our choice was to build on a cloud native architecture and use what we call like building blocks. It's kind of our current architecture is built on microservices. So everything we build is microservice oriented. It's small, it scales, it is cheap, it is fast, it's iterative, and it allows us to be able to innovate faster. The third piece also is integration. One of the key elements that we didn't leave out where we were actually building our digital solution is to make sure that actually it's integrated to our healthcare system. So this is kind of the secret sauce, which is how you are able to innovate, but at the same time being connected to our healthcare ecosystem. And what I mean by this is if you're a patient today and you download our Froedtert and MCW app, and you connect with us, for instance, let's say to schedule an appointment using our digital services, they actually connected to our EHR system. And if you want to have a video visit, the video visits is actually an encounter in our medical record. So it's kind of creating this continuum where the care experience you receive through our digital venues is the same care experience that you receive actually in the physical world in our walls. So that was actually our main focus.
Interesting. What does that look like for a patient? It's an app or is it messaging? Like, talk more about the solution and how you're engaging the patients.
We started initially with this idea of the digital front door. So it started initially where can we actually build a digital presence? And we started building a mobile app.
Sure.
And if you think about it in layers, we have the front end, which is built by a mobile application. We have a Froedtert and MCW app that you can download today on Google Play Store or on App Store, and you can download it as a patient. We build also in that front end, we build a digital identity. So one of the things we built at Inception and at Froedtert Healthcare is we build a digital identity for patients. And that allowed our patient to be able to authenticate and create their account and identity, actually using one of the latest technology and making it easy for them to create their identity natively in a digital world. That was a huge thing that did not exist before COVID, for instance, where patients had to show up at one of our clinics in our desk to create their ID. Yeah. So we actually flipped that, and patients today can start digitally that experience. The second layer of this, we build our back-end API and microservices, so to serve that front end. And that's kind of the innovation layer. The innovation is really how we enable that front end to deliver a new experience. And that means that we need to build this microservice layer. And that microservice layer is actually connected to the back, which is connected to our EHR system. So that's kind of how we architected. And for a patient, what they see is, this is the beauty of all of this. But patient, everything, this does not mean anything for them. What means like, oh, they are actually able to access services that we deliver a healthcare system seamlessly and from everywhere. So one of the things we were able to innovate on is like we build one of the easiest solutions to do video with our patients. We make it easy for them to schedule a video visits. We make it easy for them during COVID, for instance, to actually get their medical needs and to actually get their COVID testing done fully end-to-end digitally. And then we also added services like a digital protocol and digital therapeutics. So patients today, and we published about it in the Journal of American Medical Association in a JAMA paper, where we proved that patients decreased access to ER by 30% just by adding a fully integrated experience in the digital space.
Wow.
And that's kind of the impact that we can have clinically.
That's amazing. Talk to me more about the results of it, right? And maybe some of the patient reactions and how they responded to, I would almost describe it how we live the rest of our lives and then seeing that show up in healthcare. What's been some of the results and the impact on patients?
Yeah, so it's a journey, but some of the early results, as I mentioned, we started shifting our patient experience first. So among today, 80% of our patients are activated on our digital ecosystem. Wow. 80% of our patients actually interact at least once annually through our mobile application. And patients are starting to understand that actually they can receive the care and we offer them the care at their convenience. So we are shifting a little bit this traditional approach where you actually have to seek care. You have to go and schedule an appointment. You have to go to a parking lot. You have to drive through and you have to sit at the physician office. We are changing that idea where we will come to you at your point. And that changed also some of the assumptions we have around preventive care visits. Why should the preventive care visits happen actually through a provider and an office? What we started delivering is delivering preventive care and presenting other services as self-served solutions integrated into the mobile app for patients. So why not allowing the patient to make the right choice, and how we engage with them? So we start engaging with patients outside of the office around their care. And the objective of all of this is honestly to engage with the patient and making it easier to take care of themselves. If it's easier for them to buy and purchase something on Amazon.com, why aren't we that easy to actually get the right care?
Yeah. I mean, I've talked about that in a value-based care world, you need a connection with the patient. And to me, that's what you've created with this mobile app and this engagement is now you can do almost anything. You can survey them, you can prompt them, you can, encourage them. There's all sorts of things you can do with it because you now have a platform where they're engaged.
Absolutely. And this is kind of a feedback loop, which means like it's a self-reinforcing loop. When we started initially, we thought like, let's build a digital technology so we can actually serve patients and certain services. And what happens once you have the people, the technology, and actually the access to patients and their trust in the application, what happens is like you have new innovation coming in. And actually it kind of create new abilities for us to rethink how we deliver care services. So one of the things that we are launching soon is a new primary care clinic that is fully digital. Wow. That is actually integrated into our engineering and product team. So think about it in the reverse way, where we started initially delivering care and we built the technology in the back office, and now we're building the technology to deliver care to patients. So we actually build on top of it the clinical services. Wow. So now what we tell is like we are prescribing code to patients, and we are able to deliver and reinvent the way we think about our care experience as a healthcare system, actually by building this technology. Interesting.
Well, as you mentioned, we're here at AWS reInvent. There's lots of talk about generative AI. It's all over healthcare. We're talking about it as well. Talk about how you're planning to approach that and maybe layering that into your solution and how you avoid things like hallucinations. Because to your point, we need these generative AI and other tech solutions to scale to the problem. So how do you view generative AI?
I am very optimistic about generative AI. Let's be clear. Like, if it has the promise to improve care, we have the obligation to do it. Like, I take it from a perspective which is actually a responsibility for us to figure out how to do it. Which means it's not only being on the receiving side of it, it's actually being part of defining it and building it the right way. I mean, I feel like we have the responsibility and the trust of our patients and community to build the right technology and embed the right, like, if you think about it, it's the same thing we do drug delivery. Like, if you think how we build the FDA protocol, how we created the delivery services, and how we created pharmacies, and how we created the entire ecosystem to deliver the right care to patients, that's our role. And if AI has the ability to even, let's say, improve by 10% our care services today and make it more efficient, actually our responsibility is to make that investment and be part of the journey for it. So one of the roles we build, again, by building our technology, we actually developed and built within our HIPAA secure environment, a playground around AI. So we are building two things. We are actually, and you mentioned how we can make it safer for patients. We're building a lot of user research of understanding how we should interact and how we should implement AI in a safe way for our patients. And that's include our AI governance, our data strategy and security protocol, how we make sure that we are not using the data to train models, for instance, how we make it safe for patients. So we're building a lot of guardrails around it. But at the same time, we're also starting engaging our patients to understand what is the right experience for them. One of the interesting ideas we're thinking about, what if we provide a patient actually a chatbot to discuss with after their after-visit summary? You know, like the after-visit summary is usually 7 pages. Like, actually patients do not understand the words of it.
No.
So, and what do they do next? Yes, the after-visit summary provide them that this is what you need to do, but it doesn't help them to do it actually. So can we actually make AI help the patient and guide them by actually delivering those and explaining the after-visit summary, perhaps, and also telling them, like, this is the next best action, and let me help you with the next best action. So For hallucination, you're making an important point. I think this is an era where we need to invest heavily. There is a lot of work that has to be done in this.
Yep.
One of the key aspects we build using AWS Bedrock is, with our early experiments, is we do grounding. So we use a RAG approach, which is retrieval augmented generative AI implementation. And actually we're using RAG to ground it to our clinical best practices. So all our clinical best practices are actually integrated in our RAG embedding. And what we added also is we ground it to actually our content that exists and delivered to patients. And that's kind of, we train the model to only leverage this data and use it. And our initial results are very promising. Like we see that the AI model is able to be grounded to those hallucinations, and actually we removed some of the hallucination. The journey has to continue. So that's kind of where we're gonna need to improve. But those are like some of the early results where we can safely implement some of the AI. It's gonna initially start probably in summarization, in non-clinically related aspects of what we do in healthcare system, which is a lot. Like helping you with scheduling, helping you with providing what's the next best action probably. Insurance and all of that, summarizing for your after visit summary. But I think in the future, and this is where the value is, we know that the future is going to be also to help us in the clinical aspects.
Yeah, I think that's interesting. The reality, to your point, is that doing nothing has a consequence too, right? Even though hallucinations are a risk, doing nothing has a risk that's, that we need to take into account as well. How did you build trust with the staff in using the solution? You say, oh, it's easy for the patient to hop on and do a video. A lot of staff may not like that, or other engagement, right? And we know that the inboxes of doctors are full because patients realize, oh, I can do this, during COVID, and now they're full. How did you build trust with the staff, that your solution's a valuable thing and the right thing to do for patients?
You mentioned a really important point, which is, let's speak a little bit about our clinicians. I know that most of our technology is driven towards improving the patient care, but care is actually a relationship between a physician and a provider. And I think, unfortunately, we lost that trust as technology innovators for a long time. And kind of the distance between a physician and a clinician, like physician and a patient, actually increased because of the technology implementation. Well, actually, when you have to think about the opposite, how we can actually make technology so seamless that actually the connection between a physician and a clinician is so shorter. If you think about it, like there is a very famous picture in JAMA around, there was the drawing of a kid who went to a physician office, and the way she drew it was like she was sitting with her mom, and then there was like a massive space between her and her provider, her pediatrician, and the pediatrician was not looking at her. Like that's an experience of a kid, and draw the experience of being in care. And the pediatrician was looking down to their keyboard. That's her imagination of what is an experience in care, and I think was a mistake, and we haven't thought really about the impact of technology. It's a social, technical problem to solve. So how we integrate technology in the right way. And this is what we need to do. So to establish that trust, we need to actually think from a first principle of this needs to be seamless for both clinicians and patients.
Right.
I give an experience about our video visits. We spend so much effort to make sure that neither the provider nor the patient actually understand what's going on in the technology. It has to just work.
Wow.
And some of the early results, which is fascinating, we had one of the highest rated video visit experience. We do a lot of experimentation. But when you see the feedback of all patients was how great the experience was with their provider and how the provider was helpful. And by the end of the day, there was nothing about technology.
They didn't talk about
it was not that great. It was not
Which is a good outcome.
Which is a good outcome. There was no conversation about, hey, I loved how latency is on your video visit. No, patients don't care about that. So I think that's where technology, it has to disappear. And I think that's our role. I think our focus is how to make sure that the technology disappears, and actually what stays is actually that care experience. So we need to start, and that's kind of what we are trying to build today, is how we can make it engaging. I give an example, you mentioned in-basket. Some of the work we're doing is how can we actually answer the patient without needing to do an in-basket? How can we resolve the problem? I think the in-basket problem is a problem we created.
It is.
So how can we move it? And that's kind of some of the innovation we need to drive. And going back in those first principles, what are we trying to solve? Why the patients need an in-basket? What are we trying to do in the in-basket? How do we do the right triaging? And then making the right investment in strategy of solving that problem by making sure that we have the right experience.
Yeah, that's awesome. So what do you think's next? What comes next in engaging patients and being able to provide this unique experience for them?
We need, two things. There's a lot to say here, but since we are at AWS Reinvent, I think healthcare systems need to really leverage the technology in the right way. I think we have a long journey to go as an industry to be innovative. Healthcare is one of the most fascinating, innovative space that human has created. And we need to be actually at the forefront of technology. Unfortunately, over the last decade, we have been laggards. And there is a way where we need to be making the right investment. It has to be benefiting our community. It has to save lives. It has to be better in terms of cost. And because of how our demographic is shifting, we need to be able to take care of our patients much earlier in a value-based care. So how we enable that, I think technology has a big role in this value-based care, because value-based care means it's data-driven, it's engagement, it's early, it has to be convenient. We cannot anymore wait for a patient to show up at our office. That idea of the patient will come for us when they are sick doesn't work in a value-based care model. So we need to change. We have to shift the model. And I think to shift that model and enable it, it's going to need data, it's going to need intelligence, it's going to need digital engagement. And those are like the secret sauce, like we need to drive as a healthcare system.
I love it. Those are great. Three great pillars that you could build around. Well, I appreciate you taking time to sit down and talk with me in this busy conference and share your insights and perspectives and all the work you're doing to make your patients' lives better. So thanks so much for taking time to talk with me, and thanks everyone for watching and listening.
Thank you.
If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks so much.
Thanks, John, for having me.